That was a great guy.
Oh, he sure was. Okay, I'm going to, our next topic is going to be on turning scholarly activity into scholarship. And I'm going to just set the stage for Candace to talk about scholarship by presenting some background on the evolution of how universities and medical schools now consider scholarly activity. And it was about the 1940s when universities and medical schools started to really push for research. And they felt that a scholar was a researcher was a scholar. And those of the researchers and other academicians who had their primary role might have been teaching, they said, oh yeah, you got to teach, and that's easy to do. So it wasn't recognized and it wasn't acknowledged. Well, that started to change when Ernest Boyer, who was a lifelong educator and at the time the president of the Carnegie Foundation for the Advancement of Teaching from 1979 until 1995 when he died. And he challenged this view of the role of universities in society. And in 1987, he published a report called In College, the Undergraduate Experience in America. And he wrote, scholarship is not an esoteric appendage. It is at the heart of what the profession is all about. Then 3 years later, Dr. Boyer published a report, and it was entitled Scholarship Reconsidered, Priorities of the Professoriate. And in this report, he defined what it is to be a scholar, and he also redefined teaching as a scholarly activity. And he stated that the work of the professoriate had four interlocking but separate ideas. One was the scholarship of discovery. And this is what we can traditionally think about when we talk about research. The second is the scholarship of integration, which is concerned with making connections across scientific disciplines and placing the work of individuals and their specialty in a broader context, as well as educating the non-specialists. And then scholarship of application, which is taking that knowledge and then applying it in practice. And then the scholarship of teaching, which they envisioned to be you would have well-informed teachers who would stimulate their students and also encourage them to be lifelong thinkers in being creative and critical. Now this work, Dr. Boyer's work, emphasized that a teaching intervention should be as carefully designed as a research intervention or a research project, and that the end result is not the measured change from the experiment, but the measured change in the mind and the behavior of the student. In a commentary on the work of Dr. Boyle, Dr. Schneeweiss, Ramsey, and Johnson stated that it is the pursuit and the communication of knowledge that characterizes scholarship. So just to, I guess they won't show up all at the same time. Well, just to characterize the different types of scholarship, I'd like to take one study, and I think it's one that most of us know pretty well, the Adverse Childhood Experiences Study. And you know, Dr. Folletti and Dr. Anda are going to be involved in a conference this weekend, so that's great. But I think this illustrates quite well the different types of scholarship. So, as most of you know, this started in like the late 80s, early 90s. And when Dr. Folletti was writing a piece about this, about the summary of the adverse childhood experiences, it was about 2001, he entitled this summary, Reverse Alchemy, Turning Gold into Lead. And he stated that the ACE studies came from looking at an obesity program in adults. And what they found was that this program was very successful in having adults lose weight, but it had a high dropout rate. And what was counterintuitive was the people who were dropping out were the ones who were losing the most weight. So if we look at this in terms of the scholarship of discovery, what these researchers did, Dr. Folletti and Dr. Anda were the co-investigators. And in his summary of the ACE studies, Dr. Folletti says, in this first of many unexpected discoveries, he and his colleagues accidentally and to their surprise learned that a history of childhood sexual abuse was remarkably common in this typical middle-class American population. what Dr. Folletti, Dr. Anda, and his colleagues found out was that, number one, adverse childhood experiences are very common. And number two, they have a powerful relationship to adult health. So then we look at this discovery, and then when they published this in 1999, this led to many professions, medicine, pediatrics, public health, violence specialists, who then began to incorporate this idea. We wish more people would, but began to incorporate this idea of how childhood adversity is associated with poor health. And so this began to spread across disciplines. Now, if we take this study and look at its application, or the scholarship of application, I think Dr. Folletti gave a very good example in his summary of entitled, Reverse Alchemy, where he says, just as he's writing this piece, he's consulted on a 70-year-old woman who's a diabetic and a hypertensive. So he says after he reviews her record, he finds out that she's also chronically depressed. She's morbidly obese. And she was raped by her brother when she was 10 years old. So this was 60 years ago. So now he has a new way to conceptualize this patient. So he takes the patient and really begins to realize that the beginning of her adult health problems started when she was 10 years old. So she was sexually abused, which leads to chronic depression, which leads to, many people deal with this mental anguish in different ways, and many of the ways they deal with it, of course, are unhealthy ways. And for this woman, it was overeating and becoming obese. And then the obesity leads to your other health problems, coronary artery disease, hypertension, diabetes. So Dr. Folletti is able to take this knowledge and apply it and integrate it into what he does. Now comes the scholarship of teaching. So now this is our responsibility to be well informed about this early childhood adversity leading into poor adult health. And we need to be able to teach this then to our other healthcare professionals. And as a matter of fact, Dr. Anda had said that with this information comes the responsibility to use it. So about 7 years, in 1997, after Dr. Boyle had come up with the report about the scholarship reconsidered, Dr. Glassick and colleagues then came up with another report based on that called Scholarship Assessed. And Dr. Glassick and his colleagues were with the Carnegie Foundation for the Advancement of Teaching. And they developed common criteria for all forms of scholarship. And what they concluded is that the scholarship of discovery needs to be reaffirmed. But without integration, then knowledge becomes pedantry. Without application, knowledge becomes irrelevant. And then without sharing through teaching, the continuity of scholarship is lost. So Glassick and his colleagues kind of reframed the types of scholarship that Dr. Boyle described, and they reframed it in terms of knowledge. So they called it the discovery of knowledge, the integration of knowledge, the application of knowledge, and then the scholarship of teaching. So Glassick and his colleagues then, they interviewed and had discussions with many people in academics, academic faculty, editors of university presses, editors of scholarly journals, and also granting agencies. And they found that for a work to be considered scholarly, it's characterized by the following: clear goals. So we have to have very well-defined objectives. Adequate preparation. So not only does a scholar have to understand what's happening now in the recent research, but they should have a very good handle on some of the primary sources that led to the current discoveries we're making today. Appropriate methods. So we have to look at this and say, are the tools the scholar is using, are they adequate to assess their objectives? Significant results. Did the results lead to some contribution in the field? And also they remind us that eliminating a hypothesis because there was no significant difference sometimes also is very valuable in adding knowledge to the field. Effective presentation or effective communication. Scholars must be able to communicate their findings effectively. And so does the scholar present his or her message with clarity and integrity? And then reflective critique. They're finding, as most of you know, more and more agencies and granting agencies are wanting to know, well, how are you going to evaluate your program? And Dr. Glassick says careful evaluation enriches scholarly projects by enabling the old ones to better inform the new ones. So then in 2000, Lee Schulman, who was the president of the Carnegie Foundation then, it's still kind of elusive in trying to get a good handle on how to evaluate, analyze, reward teaching. But he separated the scholarship of teaching from scholarly teaching by defining 3 criteria that must be met. Number 1, the work must be made public. Number 2, the work must be available for peer review and critique according to accepted standards. And 3, the work must be able to be reproduced and built on by other scholars. So now that I've kind of given you a little background on how we look at scholarly activity today in our universities and our medical schools, I can't think of a better scholar than Candace to come up and talk to you a little bit more about the meaning and understanding of turning scholarly activity into scholarship.